Hi, I'm Karen Collins. In the first portion of my interview with Lee Jones, he shared with us the research indicating that physical activity may play a really important role for cancer survivors. But the question is then, for someone who's been sedentary, when is the best time to start that exercise? During treatment, or should they wait till later? Lee Jones is Associate Professor and Scientific Director of the Duke Center for Cancer Survivorship at Duke University.
One of the worst things you can do in any condition, not just after following a cancer diagnosis, but any condition, is just to sit on the sofa and do nothing. We know how bad just doing nothing is. So you think about cancer diagnosis, not only are individuals being told to be sedentary, but then they're getting the double whammy, if you will, because they're getting all these therapies that are causing further impairments in their bodily systems that can then, that just compounds the problem. So I think, exercise breaks that cycle. Now it's, my advice with that would be to try and exercise as early as possible. My father he's diagnosed with prostate cancer and he's undergoing ADT, and so even before he started his hormone therapy, I got him exercising as much as he possibly can, because once you have therapy, you get that hit, and it's very hard to break that cycle. So, I think from my perspective, it's exercise as early as possible, to see if you can actually, I call it the buffering effect. Can you get yourself tuned up a little bit for the therapy, so when that hit comes in, you're able to tolerate that hit and continue to exercise. But of course, individuals already going through therapy, it's like stopping smoking. As soon as you start, you're going to start reaping some of the benefits. So I think it's never too late, and there's always something that you can do to break that cycle.
But that's a good clarification point, because I think even as we've discovered some things about cancer survivors benefiting from physical activity, for a while there was some question whether it might be better to wait until after active therapy was concluded, not so much for adjuvant therapy for breast cancer or something, but some of the other cancers, chemotherapy or radiation. And you're saying that really don't feel like you need to wait?
Well, it's, I think we actually don't know the answer to that question, if the truth be told. It's, I've now been in this field for a number of years and seen numerous individuals come through our program. I just think early is better. I think early is better than everything. But it's funny you should ask that question, because I think even with something like breast cancer and adjuvant chemotherapy or radiotherapy, we really don't know if early is better. And it's funny actually, because we've just started a study at Duke, literally just started it, where we're going to be looking at this question. So we're going to be taking women with early stage breast cancer, and we're going to randomize them to exercise either during therapy or after therapy. And then we're going to be able to compare how well the groups do. And we know from some of our earlier research that if you don't exercise during therapy, you get a hit. You get a hit to the system.
Can you explain what you mean by hit?
Yeah, so I'm talking about a cardiovascular hit to the system. So we measure fitness levels, exercise capacity, before chemotherapy has begun, and then at the end of chemotherapy, we see that fitness declines about 10% on average, with about 12 weeks of chemotherapy. And people say, well, of course, you've just gone through chemotherapy, of course your fitness is going to take a hit. Well, it turns out that, typically in individuals without a diagnosis of cancer, fitness typically declines 10% every decade. And we see 10% just in 12 weeks in chemotherapy. I mean,
that's scary.
That's how bad chemotherapy is.
Is that pretty much all types of chemo?
Well, we actually don't know. So we have literally two pieces of information, one from us, one from another investigator called Kettering, who's in Canada. And this is women undergoing conventional chemotherapy, but my guess is it's the same for most chemotherapies. Okay. Because they're systemic therapies, they cause damage to a number of different organs that are involved in regulating your fitness level. So if you take that, if we know you're going to experience this hit during chemotherapy, we actually don't know. We've done all these studies, we actually don't know if that recovers. So we've done studies where we've tracked patients over the course of therapy and we see this hit, and we've done other research in breast cancer survivors again, where we brought breast cancer survivors back 7 years after completion of their therapy, and you would think 7 years out they're going to be fully recovered.
By then they'll be back.
Yeah, and what we find, they're about 30% below women of the same age who are sedentary. So what we have, again, this is not big studies that will be followed patients all the way through, but what we do, we have a couple of pieces of information now. We know that survivors who are 7 years out, their fitness levels are really low, even compared to women of the same age who are inactive. It's even lower than that. And we know we get this hit during therapy. So I actually believe that maybe without an exercise intervention, I think you kind of get this hit and you probably just plateau. I don't think people expect you to see this spontaneous recovery, and I'm sure that some individuals do because they might say, oh, I'm going to get on with my activity and they'll come back up. But I think in general, particularly where there's this uncertainty of should I be exercising or not.
Yeah, yeah.
You know, think about, we experienced, I call it the hit again, this multiple hit. So if you get that hit, and if we don't know if you're a recoverer or not, we don't know that intervening following the completion of therapy, we're going to be able to recover you to where you were even before you started therapy. So I think if you start right away, you can, and there's data actually from our group as well as others showing that some data showing that you can completely abrogate that hit. But some data from our group suggests that you can actually improve fitness during treatment. You think if you start early, you can improve fitness, and then you can keep that going after the completion of therapy. So
That's
this
a really inspiring message.
Yeah, it
for
is.
cancer
So this study's just started. So it's four groups. The first group gets exercise training during therapy, but not afterwards. The second group gets no exercise during treatment, but they then go into an exercise group following the completion of treatment. The third group gets exercise all the way throughout, and then the fourth group is in an usual care group all the way through. So using those different combinations, we'll be able to see if indeed you can avoid this hit during therapy, and if you stop exercising afterwards, then you go back down or just flatline. If you exercise afterwards, but not during therapy, can you recover? And if you exercise throughout, is that indeed the best? Which we think it will be. So we're very excited about this.
Yes.
So it's going to take about
definitely stay tuned to that.
it's going to take about 5 years to finish, but because it's just started. But we're excited about it.